Cases in Foxboro for total active positive cases that have been determined. Since the beginning, back in March 15th, we've had 31 cases in Foxboro. A total of 16 cases have recovered. Right now, there are active cases. There we have 15, and we have one more person hospitalized, so we have a total of 2 that have hospitalized since day one. There are 278 people who have tested negatively that we are currently tracking at this point in time, so that's great news. But again, 15 active cases in Foxboro at this time. So taking a look at the cases statewide, we have 18,941 cases statewide. 94,958 cases have been tested. There are 503 deaths associated with those cases in Massachusetts. And as far as Norfolk County goes, there are currently 2,007 cases in Norfolk County. That's so we've broken the 2,000 barrier in that regard. So currently 2,007 cases in Norfolk County. The greatest age group is 3,600 individuals with COVID-19 in the 50 to 59 age bracket. Right behind that, the second closest grouping is in the 40 to 49 age grouping, and tied closely to that is the 30 to 39 grouping. So 2 very close seconds in that regard. So just wanted to keep you updated on what's happening with that. The largest area in Massachusetts is in the Boston area. Actually, Middlesex County is actually higher right now at 4,045 cases, and Suffolk County is at 4,041 cases. So very closely aligned, those 2 counties are. And we are in the 3rd ranking at this point at 2,000. I take that back. Northern Essex County is 2,336, and we've got 2,007 cases here in Norfolk. So we're currently right now there are 1,700 individuals hospitalized, 5,100 cases have not hospitalized, and 12,100 cases are actually under investigation. 244 states of emergency have been declared throughout the Commonwealth. Let's take a look at the report and what's happening on that level. It's from the MRC email. The latest information we have is again 18,941 confirmed cases, 1,747 hospitalizations, 503 deaths as of yesterday at 4 o'clock. Nearly 95,000 tests have been conducted by the state public health laboratory and private testing facilities. At least 4,000 tests are being conducted every day, and over 7,400 were conducted in the last 24 hours alone. New guidance on unemployment assistance. Today, the state received the federal guidance necessary to begin implementation of the following new types of unemployment assistance created by the Federal CARES Act. The Federal Pandemic Unemployment Compensation, and that is the additional $600 per week for those collecting unemployment. When is it in effect? It'll be in effect for all weekly unemployment claims from March 29th to July 31st. Again, that's from March 29th to July 31st, and that's for the $600 per week additional unemployment compensation that will be paid for by the federal government. And folks should be seeing those checks soon. Next steps on no additional action is required for those already receiving unemployment assistance. New claimants will automatically receive this benefit once it is approved. The Pandemic Unemployment Assistance, and that is, what is it? It's the unemployment benefits for those who would not normally be eligible, including self-employed individuals, independent contractors, and gig economy workers. When is it in effect? For all unemployment claims beginning February 2nd and ending prior to December 26th. Next steps, the state is working to work as quickly as possible to put in place a system to process what is expected to be a large volume of new claims. The system is scheduled to be online by April 30th, at which time applications can be submitted online. Once a claim is approved, benefits will be paid retroactively to February 2nd to those who qualify. And the Pandemic Emergency Unemployment Compensation, and that is the 13-week extension to the normal 26 weeks of benefits per calendar year that Massachusetts residents in the unemployment insurance system receive for those who have exhausted all of their benefits. For anyone who has exhausted benefits and is still unemployed during the weeks between March 29th and December 26th is when you'll be able to still receive benefits. No action is needed at this time. For those who are eligible, you should continue to check for updates as the state is still awaiting federal guidance. The Department of Unemployment Assistance is experiencing roughly 18 times the normal volume of unemployment claims, and they have rapidly increased their customer service staff from 50 employees to over 600 employees working 7 days a week. Despite the increase, this process may still cause frustration and anxiety for those waiting on responses to claims and resolutions of issues as claim volumes continue to rise and new populations become eligible. The department is working to address the many logistical claims that the crisis has created. And I was able to actually help one local resident recently by directing him to our state senator and to our state representative's offices, and they've been able to assist in that particular claim. If anyone else is running into a roadblock or is unable to understand or get through to unemployment assistance, if you want to call me, I'll be happy to, or just send me an email. I'll be happy to try and assist if I can. For more information, you can check the website at www.mass.gov/info-details/update. Massachusetts Department of Unemployment Assistance announces guidelines on CARES. And under healthcare, today, yesterday, the administration announced additional measures to increase staffing levels to meet the anticipated surge in COVID-19 cases requiring hospital care. The measures include licensing of foreign doctors, expedited licensing for graduating nursing students, guaranteed insurance coverage of inpatient care, and a unified portal of healthcare staff recruiting, volunteering, and hiring and that is at https://mass.gov/join COVID team. That's mass.gov/join COVID team. For anyone who is looking for work and can try and help in that situation. The state has received an additional 100 ventilators from the federal stockpile, which are in the process of being delivered, tested, and distributed. In addition, Boston Children's Hospital has donated ventilators to the state to distribute to COVID-19 patients. The Patel N95 mask decontamination machine in Somerville is up and running and is at full capacity. We'll be able to sterilize nearly 80,000 masks per day, extending the useful life of existing protective equipment. And the Boston Convention Center is now being converted to a combination of COVID-19 care and emergency shelter facility in conjunction with the Boston Hope Organization. The 1,000-bed facility will be half medical, half shelter, and will help the state and the city of Boston address the prevalence of COVID-19 in the homeless community. This facility will also allow patients would no longer require intensive medical care to be moved from ICU into units in urgent care hospitals, freeing up hospital beds for patients needing more intensive medical care services. Under the small business category, a new FAQ has been issued by the Federal Treasury Department on the Paychecks Protection Program, a loan program designed to assist small businesses with keeping employees on payroll during times of intense economic disruption. And the Massachusetts Cultural Council has opened applications for grants to artists and arts-related workers who have been impacted by COVID-19. Applications are being accepted online until April 22nd. Under legislative action, the Joint Committee on Children, Families, and Persons with Disabilities has begun soliciting testimony on H4622, an act to provide short-term relief to families in deep poverty. Testimony can be submitted online, and a live remote hearing will be held via Zoom on Monday, April 13th at 1:30 p.m. Those wishing to participate can sign up online as well. And under additional updates, April is Sexual Violence Awareness Month. COVID-19 has resulted in an increased risk of domestic and sexual violence. Statewide Safe Link hotline is 877-785-2020. That's 877-785-2020. And the same resource can now be accessed through the statewide 211 number. Jane Doe Inc. also offers a Find Help search page for local resources, and statewide services are still available remotely. As a reminder, grocery stores are now limited to 40% of maximum occupancy and required to manage lines and movement of foot traffic through stores in a manner that maximizes social distancing for customers and workers. I know many of you are probably experiencing that now, trying to get restock your grocery supplies, and also this is being a holiday weekend with Passover and Easter coming up this Sunday is obviously going to impact folks to get and the lines will be long. I know that my wife just went early this morning, and of course, and the lines were extremely long, but she was able to get pretty much everything she needed. So the stores do have capacity. There are stores that have some limited capacity on the shelves right now, but other stores are actually pretty full, and so actually there is plenty of things to acquire when you get to the store. So just keep that in mind to add the additional time, and also wear a mask, wear gloves to the grocery store. That'll offer additional protection. My wife was there this morning, and she said that virtually everybody there had a mask on, and virtually everyone had gloves on. So just be mindful of the fact that when you go, that's something you should do for added protection for you directly. Just a new order from Governor Baker's ensuring access to inpatient services. This order mandates that insurers must cover all medically required costs of COVID-19 treatment in and out of network hospitals or other medical facilities with no charge to patients, including co-pays, deductibles, or co-insurance payments. Healthcare providers and medical facility insurers must accept the following rates for out-of-state, out-of-plan treatments. If insurers have a contract with a provider or facility, the contracted rate, even if the patient is not in a network that covers the provider or facility. If the insurer has no contract with a provider or facility, 135% of the applicable Medicare rate will be applied. Insurers may not balance bill or charge patients for amounts above the specified payments. And the COVID-19 demographic data, the Department of Public Health yesterday issued an order designed to expand COVID-19 demographic reporting data, including race and ethnicity, to address disparities in the virus impact and support the Commonwealth's COVID-19 response efforts. This order mandates all healthcare providers and labs to collect and report complete demographic information of confirmed or suspected COVID-19 patients. And the Department of Unemployment Assistance is holding daily town hall meetings in English and Spanish to help claimants apply for unemployment benefits. You can sign up at www.mass.gov/forms/Massachusetts Department of Unemployment Assistance DUA virtual town halls. And the state has created a new job application for healthcare workers to staff temporary care facilities in a variety of roles. You can check back often on the listings as they will be updated. And it's at www.mass.gov/apply for jobs at COVID-19-temporary case sites. And that is all the latest information from the state on what's going on in and around the Commonwealth. And in Foxboro, things are quiet as you might expect. But one thing that we do want to remind everybody of is the gatherings going on in park areas. The weather has not been great the past few days. I will note that the weather is expected to be better tomorrow and Sunday. Of course, being a holiday weekend, folks will try and get out, and we do encourage you to get outside, but also be mindful of the fact that gatherings, basketball, playing on the courts, playing using any of the equipment at the parks is off limits at this time. We don't want people to gather. We're going to be placing signs, temporary signs at all locations to make sure to remind everybody. And the police department will be monitoring those areas quite closely to make sure that people are not gathered in any one particular area. Folks have got to use common sense here, that they need to separate. They need to keep their distance from people so we don't spread the COVID-19 virus in our community any further than it already is. So far, Foxboro has done well, but we need to continue to be very vigilant in our efforts to make sure that folks stay safe and stay healthy during this difficult and challenging time. I want to say thank you to all of you for watching again. I will be back again with more information tomorrow morning at 10 o'clock. Again, I want you to stay healthy and stay safe, and I'll see you next time. If you in the meantime, if anyone has anything they want to send me on wkeegan@foxboroma.gov, and I'll be happy to send information out to you if you need it. If I need any additional help on anything, I'll do whatever I can to try and help you out. But until then, take care, stay healthy, stay safe, and I'll see you next time.